Hey, Dr. Marshall here with Powdersville Wellness. So I often get a question too about, well, how do you do an adjustment or what happens in the adjustment? Because some patients have a little anxiety about, they've heard too many things about when you do the rotary adjustments on the neck. We don't always do that, and we don't have to do adjustment that way. There's multiple ways you can adjust someone. Essentially, what you're trying to do is you're trying to take stress off of the joints, and that takes stress off of your nervous system. So how you do that is by the chiropractic adjustment. Now, a lot of times in the neck, we're doing some rotary adjustments. You're not going to do that with an infant. You're not going to do that early on with patients because they have delicate tissue in here, and you don't want to damage that by putting a lot of force in there. But as an adult, it's okay to do that because you're just moving those joints, moving that part of the spine. Now, some patients don't want that because they've read of the risk of strokes and damage to this area, and that's fine. We respect that, and we will use adjustments similar using maybe an instrument like this. So this is called an arthrostim. It makes this sound. I call it the woodpecker, and joking around with patients. Some patients call it the jackhammer because in some cases, when you have pressure and you have pain, it's because there's stress on your spine. And so you go in and you put this along the spine. Now, the reason you do this along the spine is because you have proprioceptive nerve fibers along your spine that are sending information up to your brain, and then your brain sending information down through your spinal cord, kind of like a GPS of where your joint is in space. And then you can do this adjustment. Now, it's not as quick and it's not as fast as doing what we call an osseous adjustment, which is where you're doing the drops or the rotations on the spine, but it's still putting input in there, and it gets you benefit to the spine, and that kind of tells your body that there's a problem there and your body needs to send strength and healing to that area. It helps restore some motion to that joint. And you also, as a patient ages, you may have a lot of arthritis in the joints, in the neck, arthritis in the low back. So you don't want to put a lot of force in there because it can damage that area and it can be very painful. The other thing that can happen is as they age and they get more degeneration, they're just not going to move very well. And so their range of motion is gone as opposed to a younger person. So that's another good benefit of coming in for care is if we get motion in your spine and we help you move those joints, then you can avoid some of that arthritis and degeneration as you age if we can get ahead of that and keep that motion and keep that stress off of your spine. But if you do get to those older years, 60, 70, 80, 90, and you want chiropractic care, it can still benefit you if you do have the arthritis. You're just not going to move as well, and we may use something like the arthrostim here. You may have also heard of a activator, or TRT uses a integrator. Those are other instruments and tools you can put in there, and then just the drops. So what you would do with the drop table is the patient would be laying down here, head would go up here, and then I would use this to pop the table up, and then say their butt and their lower back will be right here. Then you just come in and, sorry, that was really loud, but you would drop in that on those joints, the hips or the pelvic area, which helps take the stress off of there and helps get motion there where you may not have had motion. Now, you can also help and get that same type of motion by exercising, stretching, doing yoga, doing Pilates, doing exercising, those kind of things, which is also going to help take the stress off of your spine and help keep that strength in there. Now, we're also doing adjustments, opening up those joints, doing those things to take the pressure off, but you also want to strengthen the muscles around there to hold you in those positions, and we can show you how to do that as well.